Okay. So Lucia pulled the trigger. Good afternoon, everybody. This meeting is being recorded. So again, happy to see everybody. This is the second of our Opioid Settlement Fund community meetings. I'd like to take a minute to introduce or have our panelists introduce themselves, I should say. And actually, I'm going to go to our sister agencies first. And I'll ask Joanne to please introduce herself.
Sure, thank you. Hi, everyone. I'm Joanne Morin. I am the Deputy Commissioner for the Office of Health Equity and Human Rights here at the New York State Department of Health, and glad to join you.
And Chris.
Good afternoon. I'm Chris Smith. I'm the Associate Commissioner for Adult Community Care. Happy to be here.
Great. And I'll turn now to Deborah Davis.
Good afternoon, everyone. I'm Deborah Davis, and I'm the Associate Commissioner of Fiscal Administration here at OASAS.
And Tricia?
Good afternoon. I'm Tricia Allen, OASAS General Counsel.
Great, thank you. And Nat?
Good afternoon, everyone. I'm Nathaniel Byer. I'm the Deputy Director of Contract Procurement and Purchasing. I work underneath Debbie.
And actually, I should say, last but not least, I want to give Lucia a chance to introduce herself, as she is a lot of the energy and effort behind our RFAs right now.
Hi, I'm Lucia Perfetti-Clark. I'm the Opioid Settlement Fund Project Director.
Great. Thank you, everybody. So glad to have everybody here. As I said earlier, this is our second meeting. We're still working out the kinks, but we're going to get there. We're going to get there. I already kind of went over the housekeeping items that I had with regard to the next advisory board meeting being on the 15th. And then also a reminder about our Opioid Settlement Fund initiatives page. Just in terms of, the reason behind our having our community meetings once a month, we want to maintain as much communication as we can with our provider communities. And then when I say communities, because I'm talking about OASAS, OMH, and DOH provider communities with regard to the use of these dollars, to the extent that we are making RFAs available to providers from other systems outside of OASAS. Know that we are, Joanne, Chris, and I meet monthly, and again, trying to work through that process and make sure that we are on the same page with the RFAs that touch multiple systems, and continue to make funding available as we go forward. As a reminder too, in terms of the use of those dollars, we are looking to the board's recommendations with regard to priority areas, and even beyond priority areas, specific initiatives or specific concepts that they felt were important that we address in terms of the service delivery tied to these dollars. So on top of those 10 priority areas, I just want to remind everybody as well that there was a want to ensure that in making dollars available, we are, applying our laying our equity lens over the work that we're doing, or as we look at the work we're doing, as well as to the extent that we can, to really think about integration of co-occurring integration in terms of, both co-occurring mental health and SUD issues, since such a large portion of our population are dealing with both issues, right? So how can OMH and OASAS work together to address the needs of those individuals? I had mentioned the regional abatement earlier. So the two primary pathways we're making dollars available are through the regional abatement and then through our state operation contracts. I hope that's the right way to say it, Debbie. In terms of the regional abatement, I'll start there to say that 75% of the regional abatement plans have been received by OASAS and approved, and that totals $54 million that's on its way to local counties, towns, and cities for use to address needs at the local level. Debbie, do you want to add to and talk about that that process?
Yeah, sure. So you know, we work very hard on, not only collaborating amongst each other, but trying to look at our processes and make them as efficient as possible, because nothing is ever like that. It's not linear when it comes to the state, so even making a payments requires several levels of approvals within our statewide financial system, and then the last approval is by the Office of the State Comptroller. So it's not just reliant on us going through receiving your plans. This is related again specifically to the planned use of funds request forms that the LGUs, the 5 large cities, and the named other litigating entities are submitting to us. But once that approval is in, we have to load those budgets and then put them into the system as a payment, and then wait for all the approvals to happen. So without further ado, let me share that 50 of the 55 LGUs payments have already, they're processed. That's part of that 54 million that's out the door. I believe we have one additional LGU approved plan, and that is going through the process, but that payment hasn't been made yet. So 50 of the 55 have been made. 3 of the 5 large cities payments have been made, and are at minimally they're out the door or they're with OSC right now. And then 6 of the 21 other litigating entities are out the door. So we're really excited by the response we've received by all the named subdivisions, providing their plans to us, and us being able to make this money available to you. So thank you.
So, and that's been quite a process, and I'm grateful for the collaboration of our LGUs in working with us in just laying out the process and figuring out, how to make the dollars available most easily, and then also in terms of reporting. So know that OASAS is responsible for reporting on the use of the funds, and in terms of gathering information from all of the receiving entities. You can imagine what a huge effort that is going to be. And so we're also working with the LGUs in terms of what should that reporting look like, along with the other entities that have received dollars as a result of the settlement. In terms of just an update, where we're at with our RFAs and use of dollars, know that our comprehensive outpatient integration RFA, which totals $5.8 million, was awarded. There are 12 providers who were identified to receive awards. So know that going forward, there will be a community meeting around outpatient integration. Especially want to mention that. So if there are folks who did not apply and are interested in integrating their opioid treatment programs and their outpatient programs, please feel free to join that meeting to hear more about that process and future opportunities. I also want to make mention of our low threshold buprenorphine RFA, where we're looking to award $8 million and fund 15 providers to be able to provide low threshold bupe services. We did receive 31 applications, and it was really great to see that there were providers from all 3 of our systems. Actually, a number of providers who belong in all 3 of our systems who applied for that. We are in the process of reviewing and making awards, so I won't say any more about that RFA. And we continue to work on our addiction professional scholarship program, which will be offered through the state education system. So there'll be more information coming on that. We're still working out some of the details. We are in a blackout period with regard to our outreach and engagement RFAs. We actually have 2 RFAs to address outreach and engagement. One is for a clinical model and looking for providers who are able to go into the community to deliver clinical services. And then we also have a second outreach and engagement RFA that's targeted towards street outreach. Like I said, we are in a blackout period, so I won't talk more about that. I think the applications were due. So I do think the deadline for submissions was 4/19. So we are in the process of reviewing and scoring those applications. And then another RFA that we have out right now is the Connections to Care RFA. Those applications are due May 22nd. We did extend the deadline for the Connections to Care RFA. We did run into issues in terms of having our applicant conference. There were a number of holidays and things had to be postponed. And we also want to make sure that providers just have enough time with the information that was provided as a result of that conference to inform their application. So application date has been pushed to 5/22 for Connections to Care. We are working on additional opportunities in both along the lines of the prevention area, also for transportation and the research area. We too need to address the recovery. There are dollars for recovery efforts. And I'm forgetting one. Housing. How could I forget? Housing is another area where we have dollars that we are in the process of programming and determining how we're going to make those available. So those are the quick updates. Chris and Joanne, is there anything you'd like to add to that or any comments with regard to the work we've done so far?
Chris, did you want to go first?
Sure. I'm just nothing real specific. It's just been interesting and exciting to get involved in this initiative and see what all of these new proposals are, and working to ensure that they're, we're getting these resources out to meet the needs of New Yorkers with addictions and mental illness. So as the new initiatives come forward, we'll be happy to continue collaborating on those. So, thanks.
Great. And the only thing that I would add, so let's see, earlier this week on the 24th, there was a press release that was issued specific to our partnership with OASAS on the buprenorphine assistance pilot program. So if you're not familiar with that, the intention really is to assist New Yorkers with the cost of accessing buprenorphine. It covers the cost of the bupe as for eligible uninsured and underinsured individuals, no out-of-pocket costs for individuals for this medication. So I'm going to put the link to that in the chat in case you didn't get a chance to see it. I just want to make sure that everyone's aware as we continue to build capacity and access for individuals across the state.
Thanks, Joanne. Thanks, Chris. And actually Joanne's comments, remind me, and I think it's helpful for everyone, to remember that we do have a number of different funding streams that are coming into play. And with regard to the effort that Joanne just mentioned, that is tied to our stewardship dollars, as opposed to the opioid settlement fund dollars. I know that there were also additional settlements made, I believe it was last week, and that would indicate that there'll be additional dollars coming through settlement. And then, of course, I think everyone's aware we don't have a budget yet. We don't have an enacted budget yet, but hopefully it'll be coming very soon. And once that enacted budget is in place, we will be, considering the appropriations for this next year. So what additional dollars will be available for us to consider as part of the work we're doing through the settlement fund. So having said that, let's see here. I'm certainly happy to turn to the chat. So if folks do have questions, please enter that question into the chat. We will work our way through the questions that have come in, and we'll keep going until we run out of time or run out of questions. So whichever comes first. I do see that there's a question about the recording. So please know that and actually, Lucia, check me if this is true, that we are posting the recording for these meetings to the opioid settlement fund initiatives page. So folks can find both the recording as well as a question and answer document that reflects any questions that came in to the opioid settlement fund mailbox or that were asked during the course of this meeting. So yes, you will have access to that recording.
I can verify that it is there.
Thank you.
because I checked as we were on the call, starting this call, because there were, let's see, 9 pages of Q&As. So I thought I would print them off in case, you know, someone's on the call today that asks a repeat question. I thought, for reference, let me pull this down. So I know that it's all there on our website. So yeah.
Excellent. Excellent. There's a question about the ETA for award announcements on low threshold bupe. Lucia, do we have the target date? Do you have the target date for that?
I would say optimistically early next week.
Okay. I know that we do include in the RFA a target date for announcements.
So Connie, there was a question about integration. Is integration RFA still open? And I put in, I think I wasn't sure who I was responding to. So unfortunately, the answer to that is no, but Connie referred to, there's going to be some community meetings about comprehensive integrated outpatient. We want to hear from folks who maybe missed the RFA or are thinking about it, but have not started to take next steps. So just be on the lookout for announcements around integration, because we want to kind of hear from you before there would be any additional announcements about RFAs for that.
There's a question about applications for supportive housing CBOs. Housing dollars is one of the 10 priority areas that we are working on in terms of developing the concept and making the dollars available. I don't have any additional information beyond that, but do stay tuned for housing funding to be made available. Let's see here. So there's a question, can agencies apply for and receive more than one opioid settlement grant? And the answer to that is yes, you could receive a grant through multiple initiatives. We are specific in the RFAs in terms of how many awards we're making through each of the RFAs and whether or not entities are eligible to apply for more than one award within that initiative. So specific to the initiative, refer to the RFA, but know that, you know, it is possible that someone or a provider could earn an award under different initiatives that are supported through opioid settlement funds. This is a great question. Are there discussions on the state level to create a statewide uniform database for opioid use and overdose? And I think that would be brilliant. I think that would be brilliant. And, you know, I can't say that at the state level, there are conversations happening right now, at least not that I'm aware of. Joanne may have more insight with regard to the overdose data. But I'm not aware of any, but I think we're suggesting there should be. Joanne?
Yeah, I mean, I think that the suggestion is certainly a fair one and one that many would agree with. So there's constant dialogue around what we can do to continue to make the data easier to access as well as sort of seamless in its representation of statewide information. So more to come on that, but agreed. Certainly having a statewide access point and information would be helpful to all involved.
There's a question with regard to a target date for the prevention RFA. I do not have a target date for release. I would like to say within the next 2 weeks, but don't hold me to it just yet. And again, a question about the ETA for the housing RFA. I don't have an ETA for anything regarding housing. Again, we're just having conversations about the use of those dollars. Another question about the housing funding, will it include capital and programmatic? I don't have an answer to that. Debbie, in terms of allowable use of funds, is capital an allowable use in terms of opioid settlement?
Yes, it
Okay.
is. I think the considerations regarding capital, require much more long-term thinking. And, so not to say that that doesn't mean it's ruled out, but just understand how many dollars were put into that category by the board at this point in time and what that would allow us to do. And also, there's a lot of money going into building supportive housing within the proposed budget that will be enacted. So careful balance of, what we think we can pull off with our funding. But, there's not a restriction.
Mhm. Thanks, Debbie. So, and these are the conversations, that we have in terms of, from a programmatic perspective, what are the ideas, what are the concepts, what else is happening with regard to use of other dollars, and then of course, we also have to consider from a procurement perspective, allowable use of funds. Hence my asking Debbie about that, because certain funding streams wouldn't allow us to use them for capital projects. So it does depend on the funding stream. Chris, you had a comment?
I just wanted to say regarding Debbie's comment about capital in the budget and other programs in OMH's budget this year, we're looking at programmatically how we can ensure these resources are used to support people with co-occurring mental illness and substance use pretty much across the board. So as those RFPs start to flow out once the budget is passed, keep your eyes open for those uses.
Great. There's a question, will the same consideration be offered for the low threshold RFA, meaning having a community meeting for agencies interested in applying? And so, part of the reason why, with regard to the outpatient integration, our subject matter experts have proposed the notion of a community meeting, is to talk about the process of integration within those two program types, and also to gauge some interest, in part because we had actually put, I believe it was $8.6 million towards that RFA, and based on the awards, we did not award the full $8.6 million. And so we're discussing with regard to the balance that's left, how do we utilize those dollars and address, additional need for outpatient integration, and also assess, from the provider's perspective, what is compelling them to apply or not apply, and how do we address, and encourage greater integration of the opioid treatment program and outpatient levels of care. So that community meeting is specific to that RFA. It's specific to the want, on the part of the OASAS system to integrate those two programs, which is different than, what we offered in terms of the low threshold buprenorphine RFA. I do think, though, that it's worth taking back that comment, in that, perhaps there are conversations we should be having about providers implementing this. And I don't know, for Chris and Joanne, from your perspectives, from the DOH perspective, the OMH perspective, is that a topic that our providers have questions about? How do we position ourselves to be able to offer a low threshold BUP, and does the state need to consider additional opportunities to support providers in doing that?
So I think in response to the question, absolutely. Every opportunity that we have to look at the benefits and the space for low threshold access and reach, I think is really relevant to the conversations we're having, and looking at how we can continue to advance and increase our opportunities to save lives ultimately. So I would imagine if the question is asked, the answer is yes. We need to continue to look at all opportunities around that direct access. And we'll continue to do so. You know, I think certainly in the conversations we're having, and as we continue to work with the membership of the advisory council and the recommendations that have been made, we'll continue to move in that path and looking at, again, how do we create seamless systems, right? So that access is available to all, and as we continue to look to build equity.
Great, thank you. Okay, pivoting back to the chat. I lost the chat, Lucia, so I might have to ask you to.
It looks like this one is for the program that Joanne mentioned. Will the buprenorphine assistance program also apply to Sublocade? I'm not sure if I'm saying that right. Buprenorphine extended release.
I'm going to have to get confirmation on that. I don't want to misspeak. So let me confirm the exact medications that are eligible. Certainly, if it's there, I would imagine yes, but I will confirm that and get back with that answer.
I could just cut in for a second. It is possible that may fall under a separate program just because of the way that the medication is obtained. I know we did talk about it, and I don't recall where we landed on it because it has to come from a specialty pharmacy.
All
And
right,
I
we'll
know
circle back.
Mary Brewster is on, and she's actually the OASAS lead in managing that program. I don't know, Mary, if you have anything to add to that in addition to what T said.
I couldn't unmute myself. I was just looking that up. I think that Tia's right. If I recall, Sublocade was not one of the options just because of the Medicaid billing aspect, but I'm looking in my documents right now, and hopefully before 2 p.m. I can have a response.
Great. Thanks, Mary. There is a question regarding how many applications were received for the comprehensive outpatient integration RFA. I do not know that answer off the top of my head. I will have to defer to Lucia and her team to provide that information, unless you have it, Nat. I'm sorry, I forgot. Nat, 13. Okay, thank you, Lucia. So we received 13 applications. Okay, and actually, I believe that that is the last of the questions. So again, any questions folks have, please feel free to post them in the chat. We do still have 22 minutes to stay on to be able to answer questions, which we're happy to. Nat and Debbie, from a fiscal and a procurement and contracting perspective, I don't know if you have any other information or comments that you would like to make with regard to our process for folks to be aware of.
Well, Connie, thank you. I think we'll just, share that, we're doing the RFAs, right? So it's a competitive procurement. We are doing a Q&A session so that providers have an opportunity, or entities, interested entities have an opportunity to ask questions, and then we're posting those. And, our startup issues of like just making sure that all of our platforms, all of our provider announcements kind of get announced at the same time, which is was just a little bit hard to get it all right the first couple times. And so when we realized that, and thank you to the providers who patiently brought it to our attention, that was excellent. This is why this communication is great. And then we were able to just extend those applications, because our goal is really to address the epidemic and get as much of this funding out there to provide much needed services and medication, right? So part of that is this competitive process, right? So we do the Q&A, and then we're kind of on silent, right? Because then we can't engage anymore to give anyone any perceived benefit in filling out their application. And then the application gets submitted by the deadline, and they're held, to that deadline. And then we review and score, release awards. And then, then we submit those contracts to the AG and the Office of the State Comptroller for their review. And that can take, another 3 months before we can get an executed contract. So, so, it just takes a little bit of time, but that is, to promote fairness in procurement, right? And so we're, very happy to be able to make all this available and follow that process as efficiently as possible, and then get those contracts to the AG and the OSC to review, and then we get to execute them. So that's kind of, where we are for Connie, I think we just announced, right, the comprehensive integrated outpatient ones for the awards. So they may be the first contracts to be submitted to the AG and the OSC, and then, soon after the ones that we are, scoring and about to award. So that's kind of the process. And so, again, we're I think making great strides, and very excited to continue to move this forward.
Thanks, Debbie. We did have a couple of additional questions come in. So that, yes, the connections to care questions and answers are posted on the webpage. Thanks, Denise, for posting the link to that. There's a question about, is this applicable to school districts? Jennifer, I'm not sure what this is specifically in reference to. So if you could pose that in terms of an actual RFA or whatever content area you're asking about specifically, that would be helpful. There's a suggestion to do an RFA for a family disease management program to encourage family involvement. I appreciate the comment. Joanne, I'm not sure if from the DOH lens, if there are any efforts specifically around family disease management. I'm trying to think of the RFAs that we've posted so far in terms of any calls for, specifically working with families. I don't think that we have specifically yet, but I think
I don't know if Debbie would, who asked the question, would consider this, but the connections to care, one of the categories in the connections to care is pregnant and postpartum, recent postpartum folks as one of the groups that we're looking to have applicants focus on.
Thanks. Joanne, were you going to say something? I'm sorry.
No, I was just going to say not specifically. That said, certainly within the Department of Health, in other areas outside of the Office of Drug User Health or Health Equity and Human Rights, within our Division of Family Health, there are initiatives that certainly prioritize individuals and families.
Thank you. Let's see here. Oh, here's a question. Is the funding for these programs based on submitting claims like SOAR or advances like regular funding? Debbie, do you want to take that one?
Yeah, so some of it will be dependent on the RFA itself and how the contract is developed. So you'll have to look for that. So it's not just a general statement. But, for some of the RFAs, it'll be, the entities that get awarded, their contract will say that they will be receiving advances. Like if you're an OASAS funded provider, you will be familiar with the process of receiving state aid advances, and you'll report in the Consolidated Fiscal Reporting module, the CFR, on your expenses and revenues. And then other RFAs, when those contracts are drawn up, you will notice that you will receive a 25% advance, and then the rest will be reimbursement based, meaning you will be submitting expense reports, and it will be spelled out what you'll be providing us as supporting documentation.
Thanks, Debbie. And I'm appreciate, Debbie, thank you for your comment. Families as the first responders. I completely agree. And we will be taking your comments back. Will there be another RFA for intensive supportive crisis stabilization for communities still in need of mental health and SUD support? Chris, do you want to take that regarding crisis stabilization?
I can just say I'm not aware of any plans at this time to issue another RFA for these programs. The two RFAs are still in progress of developing these new programs across the state.
Great, thank you.
Also, wouldn't rule out doing one in the future if there's assessed need in the future. But again, no current plans until everything's clear and better established.
Okay, thank you. All right, other questions that folks have?
Connie and Lucia, you guys may have said this and I missed it, but I know that Lucia provided an answer to a question in the chat, but I just want to make sure we drew attention to it. And that was, someone asked when the Connections to Care Q&A would be posted, and it has been posted, and Lucia very nicely put the website in there. Can't remember if you guys said it, but I thought I'd share that.
It bears repeating. And actually, we did miss a question. Are there any grants available for addiction medicine and mental health in primary care? So we don't have, and I'm not sure when saying addiction medicine, if this is in reference to additional scholarships, training, fellowships for individuals, or if there's something more specific. Chris and Joanne, I don't know if either of you want to speak to the need.
Chris, you want to take
We have
that?
ongoing work supporting collaborative care, which is an evidence-based practice for supporting the integration of mental health treatment in primary care. And we're looking at some obtaining, hopefully, some new federal funds to support expansion of that, but that's still in progress. Not aware of anything else.
Okay, Joanne, were you going to say anything? I'm sorry, I didn't want to.
No, I wasn't going to add to that.
All right, thank you. There's a question, any anticipated funding for mobile crisis teams? How about recruitment and retention of workforce? All of these initiatives are so needed, but finding staff to support them remains a significant challenge. And we're aware of that significant challenge. And I do think that there's an immediate need, and I know in terms of our scholarship and our scholarship effort and some of the fellowship work that we're doing, there's an effort to try to increase the number of folks who come into the addictions field and also who are pursuing, certification. I realize that takes time, so it doesn't answer an immediate need to have staff now. I think that recruitment and retention continues to be a challenge. OASAS has made some effort to kind of support or shore up programs around recruitment and retention that's outside of opioid settlement, but we do still continue to see the need and are discussing how to address that.
I can address mobile crisis teams. We're in the process of developing an RFA to develop mobile crisis teams for 11 rural counties that don't currently have mobile crisis teams, and that should come out fairly soon. We're also working with OASAS and with OPWDD on training to ensure that mobile crisis teams across the state are best able to provide integrated crisis services across mental health, substance use, and developmental disorder conditions. And similar to what Connie said, we have both scholarship programs for students entering mental health fields. And one of our budget initiatives this year is to expand the loan payment program, which is currently in place for nurse practitioners and psychiatrists, for subsequent years to also include other mental health professionals, other licensed mental health professionals. And you know, there's all of us are aware of the workforce challenges and are looking constantly for ways to improve this. In our budget this year, following OASAS's long-standing program, we introduced a new initiative to develop basically a CASAC equivalent on the mental health side. So depending on where that goes in the budget, that's a major workforce initiative that we'll be focusing on too.
Great, thanks, Chris. Next question, what metrics are in place to measure the effectiveness of the interventions being put into place? I think that's an excellent question. And happy to say we are having internal discussions within OASAS in terms of evaluating the initiatives, and not only the initiatives, but also, you know, identifying measures to really assess, you know, the impact of the opioid settlement funds generally, right? You know, across the board in terms of statewide, and what are the measures that we can look at? What are the global measures that we could look at to really look, you know, 10 years from now, you know, what looks different? Does it look different? I think a very obvious metric is seeing a reduction in overdose deaths across the state. In addition to that, our evaluation team is discussing other indices that we may be able to utilize to assess change over time. I expect that we will be talking about the evaluation plan in more detail in the coming months. And I do hope that will actually we'll have opportunity at one of the Opioid Settlement Fund Advisory Board meetings to talk about that evaluation plan. So stay tuned, Norway, more to come. Next question, will the integrated training for mobile crisis be a part of an RFA?
We received a grant to develop a Project Echo statewide program for crisis training, specifically focused on mental health and substance use and developmental disorders. I'm going to be honest, I don't remember if we're implementing that through what mechanism we're using to procure that. But I will follow up on it. That's where we're at with the funding.
So Chris, do you have, I'm assuming you do, much like OASAS has our procurement page where we make all of our funding opportunities available. You know, and I always encourage everybody to bookmark that page, that page on the OASAS site. I would encourage folks to do that for the OMH and the DOH websites as well. So you can keep an eye on upcoming funding opportunities that may, you know, expand beyond opioid settlement, but just to be aware of much of what's happening.
Yeah, Connie, I just wanted to add to that we've been getting feedback that the all provider sends, and this is likely, I'm going to guess probably true at OMH and DOH, those all provider sends are going to your executive level folks. So if you're hopping on this call as maybe not the person who's on the receiving end of that email, just kind of making folks aware, we do send out emails when we have those announcements, and they look like a lot of the emails that come from us. So just make sure that you're checking those out as they come, because it is sometimes a pretty intense timeline for putting those RFA packages together. So checking the website is a great idea too, but make sure the people who get those all providers send emails are opening them and paying attention to when it's an RFA opportunity.
There is another question with regard to EHR and IT infrastructure developments that align with metrics and reporting requirements and available funding. So right now, I don't foresee in the immediate future funding opportunities using opioid settlement fund dollars for this. There may be other opportunities available utilizing other funding streams with regard to EHR and IT infrastructure. Thanks, Chris. Chris posted in the chat the OMH webpage for our, I don't know if that's a specific RFP or the procurement page. So thanks, Chris, for posting that. A question, will an FAQ be available for how this may interplay with reporting on the CFR?
Just to further clarify, right, the opioid settlement fund is considered a state fund. So this is considered, when you go into contract with this, it's a state aid funding source. What that means is, and this kind of relates to the question that I previously answered related to how you're receiving your funds, for those that are going to receive the advance and so forth, you will report this in your CFR. So the idea is that you will report it under the program, the PRU, that you're receiving the funding. You'll report all your new expenditures and your revenue source. It's going to be the same as you report all your other expenditures. But we will provide, this detailed answer in the Q&A that follows this conference call, so that you'll have that in writing. And then any other specific questions, we will also include the CFR mailbox, so that as the time comes, if you are an awarded applicant and it's not clear after we've given, other guidance, then you can certainly submit your one-off questions to the CFR mailbox as well.
Great. Okay. And then lastly, there's a comment with regard to any more discussions on the merge of OASAS and OMH. Thank you for the acknowledgement, Marcy. That's not directly related to opioid settlement funds, which is the topic of our meeting this afternoon. But I'm not aware of additional discussions. I'm not that high pay grade to be aware of such things. And then a last question, should the CFR be reported separately from state aid funding? I'm not sure how to interpret that question, Debbie. That's yours.
Right. So this is so I'm not exactly sure. We'll provide more guidance in the Q&A document. I think trying to describe it, this is going to be a funding source. You'll be awarded by a program and you'll report those expenditures, on your CFR. It's not part of your safe. So I don't know if you're an LGU asking this question or a provider, but it will be more clear when you have, your contract. But as a provider, if you've been in OASAS, an LGU, it's not part of your SAFA. So LGUs, so if you're talking about your regional abatement funds, that's why it's a very different question for an LGU. So thank you for providing that clarification. So, and I hadn't said it because we do have a separate call with the LGUs, but so this is not going into your CFR. So that will be different. And we'll have a reporting process set up. You're welcome. We'll have a reporting process set up for you that is to come, and we are engaging with the LGUs on the development of that tool.
Great. So with that, we're at 1:59. Thanks everyone for joining. Appreciate the questions. Know that we will have a question and answer document that includes everything that was posed this afternoon, posted to our webpage along with this recording. Know that we will be meeting again next month, so please spread the word and have all your friends join. And also a reminder, our next Opioid Settlement Fund Advisory Board meeting will be held on May 15th. Additional information about the meeting can be found on the OASAS webpage under Opioid Settlement Fund Advisory Board. Thanks a lot. I hope everybody has a great afternoon. Take care.